Hello and welcome to a new episode of Ask Your Dentist. Ask Dr. Ferris. This event is sponsored by Icon Dental Implant and Sedation Centers in Visalia, California. We serve um, we serve all the area of Central Valley, Visalia, Tulare, Exeter, Porterville, and Danuba. Even we get some patients from Fresno, Bakersfield, and much more. So, welcome again to this new episode of Ask Your Dentist. And today's episode is about dental implants. Dental implant definitely is great choice, great option for missing teeth. And I'd like to touch about some of the components. This program designed to ask some of the concern and copy those concerns that I encounter in my experience in my interaction with actual patient. Those questions, I take them to you through the social media, and these questions hopefully they are on your mind, and the answer hopefully will meet also those concerns that been maybe on your mind. And if you are about to get your dental implant and you have those questions, this is perfect program for you, or any other dental issue or problem. Those questions that you always wanted to ask your dentist, and maybe you didn't have chance to, or maybe you were shy. This is your opportunity to send us your questions and your concerns so we can answer them live here. Some of the questions come to me with my interaction through my patient experience, and this interaction is really important. And the best treatment plan is always come from those great conversation where you connect with your patient and your patient connect with the dentist and dental team, and they feel comfortable to ask those questions. So without further ado, let me get the first questions. And the first question is about the dental implant component. So I have this great patient, which is from back engineering background, and he asked a really great question about the technicals and the part that we utilize and working with dental implants. So I'd like to share with you some of those components. Hopefully, I can show them well through my webcam. Um, you can post your question. I hope you can see this. Uh, and I'm gonna try to make a connection in a clinical indication for those type of components that we are utilizing in today nowadays dental implant field. So this is the technical question, but I think it's very important for my patient and for you when you get your dental implant to realize and understand those different parts that can be used, and you can have um, your own feedback and your own ideas of how this can serve you and how those indication uh, are the best indication in your clinical situation. So I'm going to start with this part here, which is right here. I hope you can see this part, but this is titanium mill bar. So this titanium mill bar can fit on the top of two implants. And if you can see here, those attachments can be attached to overdenture that can be seated on the top of this bar. This part of the bar can be inserted inside the internal mechanism of the dental implant insert itself and could be seated like this and screw in place. then the dentures or overdentures can be seated on the top. So the goal of this component is to connect those two implants together and distribute pressures. So making those two different separate units one unit, and in this way we can get the best possible support and distribution of the load between those two implants. So if we are limited to two implants and we want to do overdentures, bar increase the retention and stability of the dentures. This is titanium mill bar. This could be also made from zirconia. This is another bar. This concept of the bar is actually cemented on a top of abutment that could be placed on those two different implants. This would be the implant position. We can cement the abutment inside this bar, okay, in those two holes. Then they could be screw in to the two implants in those two locations. Then the overdentures can be placed on the top. Two different bars. We utilize bars to connect implants and improve retention and stability of the overdentures or the hybrid prosthesis. So this is a restoration that could be cemented on a top of two implants or two different individual teeth. And if you notice here, there's a custom characterized gingiva if the patient is missing part of their tissue, their soft tissue, and we're trying to improve the aesthetic. This is one of the ways that we can build some ceramic gingiva and restore the tissue aesthetic utilizing this technique. Another smaller 2-bar titanium bar, and this is, you can see here's the screw. This is will connect inside the internal mechanism of the dental implants. So this is a single titanium abutment. And this abutment is titanium and has been galvanized to get that gold colors. Now if you can see that gold colors, which is much better and more aesthetic than the gray color. So we don't get any shadow of the part that go through the tissue. We don't want any grayish part that will implicate and compromise the aesthetic for our patients. So all my